I'll record from here and we'll see what happens. Are our speakers from CMS online?
Hey, Michael.
Yes, we are, Michael.
This is Beth. Yeah, we're on. I think, Dan, did Chris join us?
She has not yet, but I think in the interest of not, we only have a little bit of time, so I think we can go ahead and get started, Michael, if you're ready for us to get going.
Fantastic. Let's do that. Folks, welcome to our final session today at the 2022 Spring Conference pre-conference event. My pleasure to introduce Daniel Kalwa and Beth Karpiak from CMS's National Standards Group, who will be offering some updates on the group for our last session. Beth, Daniel, welcome.
Thank you for having us. It's nice to be here. I think the intent, as we understand it, is we're going to go through some of the things that I think are forefront in everybody's minds, and maybe talk about some of the things that are coming up. And I understood from Michael that there were some specific topics that everybody might want to chat about, in particular ASETT and the complaint submission process, as well as the exceptions process, and maybe a few other things during this time. So if you all don't mind, we'll start off with Beth talking a little bit about the exceptions process and some of the things that are going on with that.
Great, thanks, Dan. So I'll set the stage very quickly for a discussion about the exceptions process, but then I'm going to step aside and open the floor for thoughts or comments or questions that the group might have about the exceptions process. So generally, HIPAA provides that when a covered entity is conducting a transaction for which the standard has been adopted into federal regulation using electronic media, that the covered entity has to conduct the standard or the transaction, using that standard. So when publishing the first regulation that adopted standards for transactions and the code sets to be used in those standards, the secretary recognized that, of course, technology is not stagnant, and we want the standards that are adopted into regulation to reflect the most effective and efficient way to conduct those transactions at any point in time based on the technology that's out there and the methodology that's out there. So with that said, there needed to be a space where entities could test new or modified transaction standards without fear that that testing process would be in violation of the requirement to use those standards that are adopted into regulation. So that first regulation, in addition to publishing the adopted standards, it also codified a process for entities to request that the secretary grant them an exception to test or modify to test a new or modified standard for a given period of time. And we have the authority to approve an exception of the adopted standard for this testing purpose for up to 3 years. And that's all codified in federal regulations at 45 CFR 162-940. So the process is all there in the regs. And then we also have on our website a guidance letter that walks folks through how to submit an exception request, what that exception request needs to entail, and the criteria that we're going to be looking at when determining to approve or deny an exception request. So I'm not going to go through in detail that process because it is there for your reading pleasure. And I'll just close my remarks by saying that NSG really encourages folks in the industry to apply and submit exception requests. This really is the regulatory avenue that provides the industry with the flexibility to test new or modified standards with the intent of perhaps one day going through the formal NCVHS recommendation process and then the regulatory process to adopt those standards as HIPAA federal regulation. So we really see it as a precursor to that formal process. An exception or a new or modified standard that goes through this exception process is going to have the data and the support that we need from a regulatory perspective to facilitate that modification or that new standard through the regulatory process. Because in order for us to adopt a modification as the federal regulation, we need to be able to support that it truly is the most effective and most efficient way to go about conducting the transaction. And so this is the process by which the industry can develop that support. So Dan, is there anything before we kind of open it up for discussion to add as background?
I think it's worth reiterating that the exception process was really envisioned as the way that new standards would be tested and brought into the HIPAA sphere. And we have not historically made full use of that ability. And so the original HIPAA statute, as well as later changes with the ACA, envision a process where things are regularly going through the exception process, regularly being tested and regularly being adopted. And so that is one of the reasons that we're bringing it up now, and perhaps trying to drum up a little bit of business. We've had some recent interest from, for example, HL7. You may be aware that Da Vinci is doing an exception right now with some of their implementation specifications. So I would encourage others to either get in on that one or consider developing your own. And with that, I think
have to go to the actual breakout room link.
Michael, are we having technical difficulties? Oh.
I think we are, because I think some folks, including myself, are sitting in another room and don't have the instructions on how to enter the breakout room. So Rob, I don't know if that's something you can fix, or Nancy, but I think there might be some other folks trying to get in.
Yeah, I think Michael is trying to direct them into the breakout rooms. Again, you just go down to the bottom of the page, click on breakout rooms, and you'll see the CMS session listed. But I think I see Sam has his hand up, and I've got a question as well. So.
Great.
All
so
right.
I think as folks are coming in, we can reiterate anything that needs to be reiterated, but we'll keep on moving forward with Sam's question.
Yeah, hi, good afternoon. I wanted to focus in on the time period that these exceptions are good for. I think you said 3 years. Is there any thought that's gone into what happens if the 3 years becomes exhausted?
So there is, I'm not sure this gets to your question fully, but I'll see if it does, and then we'll go from there. So after the initial exception can be granted for 3 years. So that would be the 3 years to do the testing and submit a report to us that includes a cost benefit analysis of, yes, we think this is a good standard that should be proposed as a regulation or not. And if that report, and that needs to be submitted 90 days after the test is complete, if that report says, yes, this went great, and we want to move forward, the secretary can grant an extension of the initial exception request, and it is not specified in regulation how any limits on that extension of the request. So if the test goes really great, and there's tons of support that it should be adopted into standard, and again, it would have to go through that formal process, but if the test supports that, we could consider extending it for some period of time.
Okay, because the reason I asked was because I believe it was maybe somewhere between 10 and 15 years ago, a couple of provider facilities, Mayo, my own organization, Medicare services at the time, and one or two others got together and did get an exception on how to do attachments. And when we went into production, we were getting great benefit out of it. And then the time period expired and it just died on the vine. It never went forward. It never continued. So, if we go down this road of starting to do new and creative things that often present themselves as an exception.
Mhm.
If it does become beneficial, we don't want to have to stop using it after the first X number of years in the time period.
Yeah.
So we would have to stop using it essentially if it doesn't become a standard, a new standard or an additional, you know what I'm trying to say.
Yeah, no, I think your point is well taken. And I think it helps us to emphasize a point that Dan made, that the exception process isn't the end. It's the way to test it and get the data to support then going through the formal recommendation to the DSMO and to NCVHS and then the regulatory process. Because you're right, if the exception ends and that recommendation and the regulatory adoption process doesn't continue, then that exception does end. But hopefully it's a feeder towards the ultimate adoption of that exception if it is successful.
Okay, thank you very much.
Rob, I think you were next in line. Looks like you got your hand up too.
Hey, I appreciate that, Dan. And Dan, as you mentioned, you've not had too many instances of folks going through this process. One of the things I'm interested in is hearing a little bit more, Beth, about these reports that are required. Not that you have to give specifics about any one case, but I'm interested in the sort of the style and the length and the difficulty in creating these reports, because that might be one of the barriers to folks taking on this.
I'll speak a little bit, then I'll turn over to Dan for kind of more technical thoughts on it. But the regulations aren't real specific in terms of what the report needs to look like. What governs the report is the testing plan. So a piece of the initial application. So the initial application for a request is going to have a proposal that's generally explaining why this modification or new standard is going to be a significant improvement on the existing standard. And there's some various principles that the requesting entity must use to justify why they think that. And then a second piece of the initial request is a testing plan. And so that plan is going to be detailed enough to justify that when the test is complete, we're going to have significant data that's going to help support potentially the adoption of the newer modified standard through the regulatory process. So I think the report, although not specified in the regs, what type of detail there needs to be, other than it is specific, there has to be a cost benefit analysis. I think the report would largely pull from that testing plan. Dan, other thoughts about details or difficulties with reports?
I'm not sure we can really say. I'm aware of, I think this is the third official one that has ever been done, the Da Vinci one that I mentioned. So it really can be negotiated, but as Beth mentioned, the presumption is that we would agree on the test plan, and then the report would give us the data of the test plan, and that if it's good, then it would be rolled into rulemaking. If everybody agreed that it should go forward and then the VHS agrees, that would be where we would draw the proof, if you like, Rob, when we're asked, well, why do we think it's good? We could say, here's why we think it's good, because it works and we tried it and here's what we discovered. And that's what's envisioned in the process. And that you may have heard me talk about it before. That's one of the things we substantially lack each time we go through around and around in this process is how do we know it's better and how do we know it works?
Yeah, very helpful. Thank you both.
So we did have Christine join us. She was one of the unfortunates caught in the breakout room issue we had. So if everyone doesn't mind, I think Christine wanted to say a few things. So we'll rewind a little bit and let Christine speak to us. Thanks, Chris.
Thank you, Dan. And yes, I was one of the unfortunates stymied by technology in the other room. And I'm glad to hear that everybody went forward without me. So we just wanted to give like a really quick update on what's been happening at CMS at the National Standards Group. And of course, as you know, from the Unified Agenda, we are working on regulations around attachments and the pharmacy standard. So that is taking up a great deal of our efforts, and it is moving along. That process, as you know, it is a long and a little bit convoluted process, but it is moving along. So we're happy to be able to say that at least. We are trying to focus on providing you with more information. And I think Beth might have talked to you about reports that might come out of our compliance reviews and out of our complaint process. We're trying to assemble data in a way that would be useful to folks to try to, how can I say, focus on typical errors so that people can avoid them. So we are trying to ramp up our communications with our stakeholders, which, were stymied during COVID. As many of you know, prior to COVID, we had begun regular outreach meetings, listening sessions with our stakeholders, and they were interrupted, as were all CMS communications, except those things focusing on the pandemic. But now we are able to resume some of that. So we are going to begin our outreach listening sessions with various stakeholders. We are, as I said, trying to ramp up the written materials we put out. The guidance letters that we just put out are an example. And you'll get some more fact sheets that we're working on and information bulletins that we hope will help everybody have a better understanding of how to comply with the administrative simplification requirements. We also, as you probably are all aware, the NCVHS sent us a letter recommending that we study the implementation of ICD-11. They gave us a very good and detailed and comprehensive list of questions that need to be looked at and studied before anyone determines whether or not it's a good idea to go forward with ICD-11, and if so, when and how. So we have begun the process of trying to organize and fund all that research that was recommended by NCVHS. So we are in kind of a procurement stage right now for that work. Once that work is underway, we do plan to have communications as much as we can with industry, though I will say it's not our intention to confuse folks, because right now ICD-11 is an unknown as far as whether or not we'll go forward. The NCVHS has not given us a recommendation to go forward with adoption, but just to study the topic. But again, in the interest of being transparent and of communications, we will try to develop some milestones that we can keep the industry posted on. And I think that's about all I wanted to touch on. Are there any questions for us?
Hi, Christine, it's Sam.
Sam?
How are you doing? I was curious as to whether or not your group is going to be addressing the continual number of bots that are cropping up to kind of compensate for areas where there is no standard yet, or the standard hasn't been adopted, so is not widespread usage, and the industry has compensated for that by getting the goal done using, what I'll call non-orthodox methodology. Mm-hmm. Is there any consideration to how that, when the incentives and the benefits of adopting a transaction are reviewed? It's kind of like you're not starting from foundation anymore. You're starting from the point of where the bot got us to, and question becomes, okay, well, why fix what's not broken? So if it becomes a basis of, doing implementation of a new standard, as opposed to turning on something that we're not doing anything about, there's only so many resources to go around.
Right. And that's pretty important to us. That's the whole reason behind the notice and comment period, because, we, as you know, are mandated in statute to adopt certain standards, and we go forward with those during the notice and comment period for a regulation to adopt a standard. That's the chance for the industry to tell us, we have another method that we think works just fine. We don't need yours, or any other kind of feedback they want to give us, in that respect. And those comments are really critical to us. They really drive what is going to turn up in a final rule. And as you know, in the past, there's been some standards adopted that we backed off on, because again, once they were adopted, the industry, even after they were adopted, the industry came back to us and said, something, we don't really need this. We don't need to reinvent the wheel here. We're doing fine with the methods that we have. And in that case, we rescinded that particular standard, the health plan ID. So anyway, Sam, right, we don't want to reinvent the wheel. If something works and it's working fine, good. If it can be adopted as a standard, I mean, that would be the sensible route to go for the SDO to go to NCVHS, propose that the standard be adopted, and then we can move and we can act on that recommendation from NCVHS. So did that answer your question, Sam?
It did. Thank you.
Okay, sure. Mike?
Yeah, hi, Christine. So I just got a question. I know that pre-COVID that the National Standards Group was involved in a pilot for the compliance review program for providers. I'm wondering if you can provide any update on where that pilot is and when it will, be completed and what the plans are.
Initially with compliance reviews, we did pilots, but because there were actually, no, I'm not going to say virtually no complaints against providers. There were no complaints against providers. So it didn't make sense at that time to run a pilot for providers. A few providers came forward to us after that and said, well, we think we should be allowed to have a pilot. And so when we went to solicit volunteers for the provider pilot, we got none. So right now, we're not pursuing a provider pilot for the compliance review program. I think that if something came to our attention that made us feel like that could be really valuable or really, move things forward, we would certainly do that. But at this time, we're not intending to do a provider pilot. Anyone else?
Well,
All right.
This is
Sorry.
Mike Gunnison again. I'll follow up with a question if you don't mind.
Sure.
You mentioned the attachment transaction standard is something you're working on. And obviously, I think this group has been very interested in following the bouncing ball of the unified agenda, fall, spring, the next year, spring, fall.
Yep.
And obviously, we've all been anticipating this attachment regulation with great anticipation, I'll say. So, is there any idea as to when this may come into a proposed rule?
Once we draft a regulation and we put it into a clearance process, and the clearance process is a multi-layered process, goes through multiple rounds of clearance and comments from HHS and others. So it is going through this clearance process. Because of that, we are never able to anticipate precisely when the NPRM will be published. I will say this, we are pressing forward. I know it's hard to use the word haste in this process, but I'll say that we are putting our greatest effort towards moving this forward. We know how long you've been waiting for it, and just as long as we've been waiting for it. and we want to see that come to fruition. It has made substantial progress in recent months, but Mike, I wish I could say when, but that is a thing that's sort of out of our hands. It depends on schedules of the department, of OSORA and OMB and others as to when this rule comes up in the queue and gets the final reviews and the okay to get published as an NPRM.
Well, thank you, Christine. That was very helpful. Thank you.
Rob, I see your hand up.
Yeah, I won't ask Mike's when question again, but I'll ask about the how, because what's interesting about the attachments rule is we had an ONC RFI come out talking about incorporating attachments and attachments rule into their certification program. So I guess I've got sort of two questions. One is, are you aligned with ONC? Do you have sort of joint meetings and a joint effort in terms of how to release the rule and how ONC will leverage the rule in its certification? And is there any discussion about staggering the compliance date? So for example, have software vendors have a compliance date some X number of months prior to a full compliance date, so then providers would be able to have their software updated and ready for when the go live date is announced.
Yeah.
Thanks.
First of all, we do talk with ONC and we've been talking with them often. And we would like to be fully coordinated with them if possible. I don't know that we have talked about specifically staggering effective dates because, how can I say this? When we don't know precisely when our NPRM is going to get published, we can't know precisely when our rule would be effective. I think ONC is in the same spot. You know, they can't really predict precisely when their rule would be effective either regarding certification. Dan has been very engaged with a number of folks over at ONC. Dan, did you have anything that you want to share on this topic?
I don't know specifically, but I will point out, Rob, that at least as far as the HIPAA regulations go, there is never a requirement to wait, right? So, and all the requirements under HIPAA are almost universally on health plans rather than on, for example, providers and clearinghouses. So, in the HIPAA statute, we are required to give for a new standard such as attachments no more than 2 years for what it terms large health plans and 3 years for small health plans. But that is the latest possible compliance date. From the effective date to the compliance date would be 2 years and 3 years. But there's nothing that would stop anyone from coming into compliance earlier. As far as going farther than that, that would just be the limits of what we could consider. And you also have to keep in mind, we also have to try and juggle things like the pharmacy update. And, I'm sure everyone's waiting with bated breath to see what CORE might choose to put forward, which we would also have to juggle. So it's not terribly easy, but if anyone has a solution for us, please feel free to send it to us, because we know that the industry always has competing efforts, and usually the same, the same development staff probably working on most, if not all of these, depending on what your team is. So we are cognizant of it, but it's very difficult to plan until we get an NPRM out, and then once we know when the final is going to go out, then we would be able to have some more concrete dates for you.
Excellent. I appreciate that. Thanks.
Heather, it looks like you have your hands up.
Yeah, thanks. This is basically kind of following up on Rob's question, maybe just taking it a little bit different direction, but the same general concept of alignment and coordination, along with the attachments, NPRM being listed on the unified agenda, there also is a NPRM that is actually a new version of one that came out at the end of 2020 from the Office of Burden Reduction on prior authorization for Medicare Advantage and other federally funded plans. And so it would seem that there would be some possible overlap between the attachments rule technology and what the kind of technologies referenced in that rule, like the Da Vinci technologies. And I just was wondering, about your conversations with that group about, how your rule intersects or interplays with that rule, because that rule obviously only applies to certain types of payers, whereas yours would obviously apply across the board. I was just wondering if you could talk about that a little bit.
Well, Heather, I'm not sure I can be terribly specific, but I can tell you that we're in more or less constant communication with our sister group that's working on that. But that's not, that particular rule isn't in our shop. I'd hesitate to comment too much further on that.
Dan, this is Rachel Forrester. Hi. I just have an observation that might be worth sharing here. And that is that a lot of the FHIR API-based IGs are being developed under HL7 rules and procedures. And what's happening with most of them, particularly those under Da Vinci and now the fast ones that have moved over there, the connectathons and the testing of the IGs is becoming more intense, so that when that IG might be ready to be approved by a regulation, it's been tested by vendors and implementers and that kind of stuff. Unlike what happened with the X12 stuff, those things go out as published TR3s, and they haven't yet been tested.
Well, yeah, you're absolutely right, Rachel. I recall, as most people, I think, 60-20 and all the things that went on with that. But you're absolutely right. The Da Vinci team within HL7 is working on some of their implementation specifications, and we are acutely aware that there's other guides that are being tested or being developed and perhaps voted upon. It's my personal hope, if I can editorialize, that we might be able to do some official testing with that, maybe through the exceptions process, if there's interest in those new guides being tested. Looks like Sam's back up.
I am. I think I heard Rachel mention X12. I want to know if you could comment on where you guys perceive us being towards the next generation of X12 to be adopted. It's been 10 years or so since we went to 5010.
Well, I'll tell you what, Sam, that is almost entirely up to X12. That is not up to us. I don't think I can give you more information on that. My understanding is that they're close to proposing something to NCVHS, but I don't have an inside track that I can share with you.
Okay, thanks.
Was there anything else on this topic? Okay, so one of the other topics that we were told that there was some interest in was revolved around the ASETT system and enforcement and compliance and the complaint process. What I'm going to do is I'm going to put a couple of links for those that aren't familiar, both to our homepage and to the actual ASETT application in the chat, if you care to reference them later. I don't want to assume that everyone is entirely familiar with how our enforcement process works. So just at a high level, under HIPAA administrative simplification, our group, the National Standards Group, is responsible for enforcement of the transactions, code sets, unique identifiers, and operating rules. Now, the reason I say it that way is because also under administrative simplification is privacy and security. That is in the Office of Civil Rights. So complaints about the things I listed first come to us. Anything about privacy and security should be going to the Office of Civil Rights. And so we have two lanes or methods of doing compliance and enforcement. The first is complaint driven, and it is the most active and I would say the most useful to us. So our ask is, if you're aware of things, please don't let the term complaint dissuade you from using the system and tell us. telling us, because don't assume we know. I found out a particular issue like 2 Thursdays ago that apparently everybody's known about for 4 years, and I just found out about it. So I don't know if that's me or or the system. But at any rate, the ASETT system is where you can go to either test your transactions or submit a complaint to us. It is, and admittedly, a rather lengthy process, and there's a very specific reason for that. When you're making a complaint, it kicks off a rather extensive investigative process for us. So most of those questions and the fields we are asking for when you're going through the ASETT tool and preparing a complaint are things that we will very likely come back and ask you anyway. So if you make a complaint and you have that information at your fingertips or able to get it at the initial time of making the complaint, we can speed up the process by ensuring we have all the information you have available to give us at the time you're making the complaint. And the reason I put it that way is because the process really is investigative, and it is not sufficient merely to have someone make an assertion of a violation or non-compliance. We really do investigate. And so one of the things we will immediately ask is, well, how do you know? What makes you say that? Why are you complaining? Right? And it's not because we don't believe that there's an issue. It's because we need to have the specifics so that when we go against the other entity that is being complained against, we have specifics. It's not enough to say, hey, we've heard from somebody somewhere that you're not doing something right in one of the transactions, but we don't know which loop and we don't know what code, and et cetera, et cetera. So that's part of the reason ASETT is set up the way it is. Now, that being said, that doesn't mean we can't improve it. So we are, Chris has mentioned, we're in the process of working on improving our enforcement in general. That includes the complaint process. So if you have any comments or proposals for how we should be running the complaint process, I would encourage you to submit them either through the ASETT contact or our general administrative simplification contact information. Now, the other half of our enforcement process, and sometimes they're used interchangeably. So we try to just talk about enforcement, and we have one process that's called complaints, and the other side is called compliance. And Christine mentioned it a little bit earlier. Compliance is a process where we randomly select health plans, and we go through and test their compliance using, again, the ASETT tool, the same tool that everybody has access to test exactly how compliant they are with, for example, the X12 transaction. And there is a whole process around that. And what we do is we release quarterly reports about our findings in the compliance process, and you can find that in the link to that on the enforcement page that I linked to in the chat. I can say that at least as far as compliance goes, it's not. I don't know how to say this. It's not terribly interesting. It's usually issues around correct use of codes, correct use of patient identifiers and addresses, and there's very often discussions about whether it's required or not in certain transactions. But if you're interested, I would encourage you to look at those reports that we publish. Now, I don't know if were there any specific questions that anyone had about that process? All right, I'm going to take that as a no, and it works perfectly, and everybody's happy with it. I don't recall what the next thing was. Beth, do we have another item on the agenda? It looks like we still got a couple of minutes. We can probably get it in. Uh-oh, we can't hear you now, Beth. Did your mic die?
Nope, not hearing you, Beth.
Oh no. All right, well, while she's working on that, I think Chris already covered, and we already talked about a lot of our plans going forward. I do think we also want to, we want to mention that Beth and I will be giving a presentation on our most recent guidance. That would be the guidance around the EFT ERA and the business associate letters that went out fairly recently. And I think it's also worth mentioning that we do expect to publish letters on an increased cadence. So it is our goal to start addressing some of these lingering topics even if they might seem minor. We're going to comment on things that we're aware of and we think are of interest to the industry. So this first pass with business associates and EFT ERA is just the first of many to come. We are just about on time, and Beth says that I did a good job plugging for Wednesday and she has no more comments. So are there any final questions or comments in the last 2 or 3 minutes we have?
Dan, it's Rob. I'll just say a couple of things. One, we really appreciate Chris, Dan, and Beth, you engaging with the WEDI audience today, but also in general, you've been a wonderful partner with WEDI. We hope that we're able to give you some information that is helpful. If you do have issues that you want to run by a work group or two, feel free to come to WEDI. We can serve as a platform for you to get some feedback even before you issue guidance or regs. Right. So happy to help.
Yeah. We appreciate that, Rob. As you know, we've called upon you recently for information, and it's really very helpful because we're not a covered entity. We're not there in the thick of it doing the work day to day. We only know what's reported to us. So we really do appreciate that WEDI is there to help us, and we really take your input very seriously. It's really important to us. So thank you.
No, thank you all.
Okay.
All right. Well, if there are no other questions or comments, I think that probably wraps it up, Michael.
Thank you very much, Dan, Beth, and Christine from CMS. Thank you very much. I'd like to hand it off, if he's available, to our President and CEO, Charles Stellar, who will close out the day.
Michael, are you hearing and seeing me?
I hear and see you loud and clear.
Great. Well, thank you to our panel that just finished and your colleagues, Chris, at CMS, and we look forward to doing exactly what Rob described, which is how we can be of assistance, how some of our work groups can be of further assistance in terms of getting some testing the waters and getting some feedback for you. And that's something that we always look forward to. And I'm sure that all of the members of this audience would agree that this is the way to learn, and this is the way to hopefully address some questions that we have system-wide, and it's the only way we can do our improvements, I think, is not with the hammer, but many times with education and understanding. Thank you all for attending. Thank you, the previous presenters, and we will see you at, we'll just reconfirm, at 10:15 tomorrow morning. Is that correct, Michael?
That's correct.
And several of us will be doing the coffee kickoff, and we certainly look forward to all of you attending tomorrow. And thanks for joining us for this first day where we get to know some of the work groups, and we also have some afternoon sessions. So join us tomorrow for our coffee kickoff at 10:15, and thank you again.